Hello, I'm Dr. Dazz. Welcome back to the show. As usual, I've got Ferg over there revoicing me. So, welcome Ruth. You do research into ageing. Do you want to tell me about that background?
Yep, sure. So I've been working in research and teaching and looking at ageing for almost 15 years now, so quite a long time. My main interests are really interested in keeping older people well and socially connected, but I'm also really interested in the voices of older people, so making sure that all the research I do involves going out and talking to older people themselves, especially older people who might be sort of regarded as being on the margins or maybe more vulnerable. So, you know, maybe people from culturally and linguistically diverse backgrounds or in low socioeconomic areas or older people with lifelong disability, that sort of thing.
Just wanted to tell people that Dr. Ruth Walker was one of my PhD supervisors who put up with me. And we had a lot of good arguments.
We did. This is true.
So similarly, the research that you did with me was researching people on the fringe. And I remember that we had a number of really good conversations.
We did, yep. And a lot of the work that I've done, it does involve talking to older people who are more hard to reach or, you know, maybe don't usually have their voices heard. So that's been sort of my passion, is to understand what ageing means for older people on the fringes.
So what made you get into that field?
Into the field of ageing, it was. It's interesting. I mean, this is probably going back a bit too far, but I've always had a real affinity for talking with older people. So I had a really close relationship with my own nana. This is back in New Zealand where I grew up. And she was just a really important person to me. And I think, you know, not all people find older people interesting to talk to. You know, there's often people think, they just don't remember things, or their stories aren't interesting once they get old. But I really found that after I finished my PhD, there was a real need to do some research. The first study that I did was looking at older women living alone in their neighbourhoods and what was important for them. And what those sort of studies found was how important social connections were for older women living alone in their neighbourhoods, whether that's, you know, people over the fence or whatever it might be. So that really started my passion in going out and talking to older people firsthand and finding out ageing is like for them.
Do you see any repeating themes over the past 15 years or more?
Yeah. One of the big things I always found is, well, there's probably two things. One is the importance of family and friends for older people or social networks, but that importantly that can be a cause of stress and also a positive for older people.
Yeah.
So when there's, family discord or stress from amongst family members and things like that, that can be really quite detrimental for older people's well-being. So often we hear that, social support and social networks are important, but for some people it can also be a negative. The other big thing I've found is that often older people, so I'm really interested in transitions in the lives of older people, whether that's, receiving a dementia diagnosis or becoming a widow. When older people have to face these life transitions, often they don't know how to navigate systems. So there's real issues around preparing older people for these transitions, and a lot of the government supports and things are all online, and there's that assumption that older people, you just go online or you get a family member to help you go online and find out what support's available for you. But if you come from a culturally and linguistically diverse background or you have an intellectual disability, those sort of systems are really hard for older people to navigate. Yeah, so those are probably the main things that I keep hearing over all those years. Yeah.
So do you find that people reach a certain point in their lives where they go, now I'm reaching my elderly years? Or is it always a specific event, like you just said?
I think it's changed, definitely. I think it used to be that, when older people, they worked and then they retired and then, their post-work sort of life took a hold. But I think for older people these days, there's no such thing really as retirement. I think people just change the things they do, and they still dip in and out of the workforce and want to stay engaged as well. My grandparents' generation definitely did see retirement as, okay, now I'm older and now I just sort of stop doing stuff as much. But I think these days, older people are really keen to keep engaged in lots of different ways. So it's not so obvious, that someone's old.
Is it that they're keen, or is it that they feel pressured?
It depends on the person, I think. That's what a lot of research finds, is that the way an older person ages is a continuation of their personality, really. And I think for some people, they've always wanted to be involved in stuff. So as they get older, they just want to keep, they might pare back a bit what they're doing, but they still want to be engaged. So that, I don't think they feel pressured to do that. That's something they naturally want to do. Whereas for other people who are more, maybe do want to be a bit more, things to calm down and slow down, there is that pressure, you've got to join a bowls club, or you've got to be social, or you've got to get out, when really that's not a good fit for them. So I think there is both pressure, but also people just sort of tend to do what they've always wanted to do.
What advice would you give for an older person? I'm not old yet.
Not for you yet. No, this is way down the track.
I am thinking about it. Do you have any advice for the two young men here?
Yeah, and me too. No, I think it's very personal as well. I think it depends, but I think staying interested in things, whatever that might be. So I wouldn't say keep being social if that's not something that you naturally want to do, but keep interested in what's going on around you, about the younger people, about the world around you. Keep your passions and your interests going as much as possible. That's probably the main thing, and keeping mentally engaged in things, doing crosswords and those sorts of things, if that's what you like doing. But yeah, just trying to keep your brain active and your body to the extent that you can. But yeah, I think just being interested and engaged is probably the main thing we could all do as we get older.
I get the sense that that most research is in the general population. So I know that you've been involved in other things. I was involved in one of your recent research projects, which related to the topic of our last Dr. Dazz Wants to Know Everything with Dr. David Holden. So it's around severely disabled people at the end of life. Ensuring that they get what they want. They get the right palliative care. Have you done other research around disability?
Yeah, so one of the biggest studies that I'm just starting to look at is about families with older adults who have intellectual disability, and what happens as they get older, the person with intellectual disability, and what happens for their mum and dad as well in terms of future planning. Because there needs to be a lot of work in that area around better preparing families to negotiate what happens as the needs change and the parents get older and the person might need to move out of the family home, that kind of thing. But you're right, a lot of our research around ageing has been done, or tended to be done, amongst the general population, not so much with people with disabilities. So it's definitely an area where we need more.
So do you have any hunch about what you might find in the population of people with disabilities? Would be the same as in the general population? Do you think it'd be the same or different?
Yeah, I think people with disability probably have the same concerns and the same needs and wants as the general population as they age. You know, want to be able to stay living in the sort of the community or the neighbourhood that they are familiar with. They probably, you know, as well want to stay connected with friends and family and be able to stay well. So all the same sorts of areas as in the general population. There may be some added layers of complexity there that need to be navigated, but essentially I think, the same.
I imagine that they would be more aware of needing some. Oh yeah. Some of them may be more aware of how to get more support. Or more aware of what's not available.
Although it gets tricky too because of, you know, ageing and disability are sort of in two different government portfolios at the moment. So like the aged care sector doesn't really talk to disability or know about disability and vice versa. So it's
I don't know about now. It used to be that when I got to 65, I would be not disabled anymore.
You'll just be older, not disabled. I know.
It's a miracle.
It's very it's an arbitrary.
I think that with the NDIS, it's changing a bit.
Yeah.
Changing. Sanding back the edges a bit. Thank you for the interesting conversation.
Great. Thank you for having me. It's been great.
Thank you.
That was all right. God, you put me under the pump there with all those questions.